Okay, so we're moving on to the cheek and the temple area, but before we do, Ada, I want you to switch the tip. We're going to go back to the fine tip. Again, I only want you using the fine tip or the small circular precision tip on the face. Now, with your stroke patterns, it's so important that you do what Ada's doing and you brace the skin and then take the wand and move away from the brace. The cheeks, it's a little fleshier there. That skin is a little looser. So, the suction, when you first do it, it kind of feels like it's grabbing on and not going to let go. I don't want you to be afraid of that. Just kind of move with the suction. So you'll notice that Ada is starting to get a little bit pink. That's okay. Don't freak out when that happens. It's supposed to happen. Again, we're taking off that top layer of the epidermis, really getting all the dead skin cells off, revealing that new, fresh skin. It's going to be a little pink. That pinkness will go away within 30 minutes or so. So Ada, go ahead and move up to your temple area. You'll see she's bracing the skin. She's doing nice quick strokes. And it's so lovely how she can get so close. Now, you don't want to get all the way under here. Okay, stay away from this super delicate tissue right under the eye. But with these, with the lines close to the corners of the eyes, you can get right up in there. And that's one of the advantages of the diamond tip versus the old crystal version that we had at the office. With that one, you have to worry about the crystals going in the eyes, going in the mouth, going up the nose. With this, keep your eyes wide open, go right up in there and really attack those crow's feet.
Like that?
Looks good. And see, you already, you have like this beautiful pink glow. Looks amazing.
Thanks.
So that covers the cheeks and the temples, and now we're going to move on to the lips and the jawline. Okay, now we're going to move on to two of my favorite areas to treat, the jawline and the lips. Now for this, Ada, I want you to switch back to that smaller precision tip. Okay? So as Ada's doing that, I'm going to tell you a little trick about how to define your jawline. Now, as we age, this all starts to sag a little bit, and you do sort of lose your jawline. So one thing that you can do with this tip, she's all ready, that's great, is brace your skin right at the chin, Ada, and then take that small tip and just move it in upward motions. There you go. Brace that skin a little bit tighter here at the chin, okay? And then move this in these upward motions. Now, you do this over time. It goes back to that whole thing we've already talked about with stimulating blood circulation, increasing your collagen production. So plumping all this out, which is going to, in turn, really define that jawline. Okay, now another little trick. Everyone thinks that I inject my lips, and I don't. What I do is I use microdermabrasion on my lip line. So take that little tip, start again, brace it right here in the middle of the lip, okay? And then quick little strokes right above the lip line. Now, for those of you who smoke, this is going to be a godsend because it really will help to plump out those smoker's lines and give you big, full lips. You can do it on the bottom as well. And again, please make sure that you're using the small circular tip for this, okay? And keep it on a lower setting of suction when you're doing this on the lips. That looks really good. Okay, so now let's move on to the next section where we're going to address the neck and the chest. Okay, now let's work on the neck and the chest. But first, Ada, go ahead and switch the tip again. We're going to go back to the fine tip. It has a wider edge on it, so it allows you to cover a little more area. Okay, so let's start on the neck. Now, Ada, again, we're going to brace the skin, and you're going to move away from the brace. So whatever's more comfortable for you. If it's easier to brace at the bottom and move up, or vice versa, brace at the top and move down. Either way is fine. Now, I'll tell you that I have patients coming into our plastic surgery office on a daily basis wanting to know what they can do to make their necks look younger. The neck and the chest, those are the two areas that are the first to show the signs of aging because we get so much sun damage. Women, we're constantly wearing V-neck or low-line tops, so our chest and our neck are continuously exposed to the sun. And that's why you see lots of, women with the dark brown spots and the saggy neck, the wrinkles on the neck. It happens because the sun is breaking down your collagen, causing damage to the connective tissues, and that's what causes wrinkles. So, two things. One, we're going to exfoliate, get all that dead skin off, lighten all of that up. And then two, you have to use SPF on these areas. You should use it all over, and there's a great one that comes with this system. We'll talk about that a little bit later. So she's nice and pink, and that's great. So let's move on to the chest.
Okay.
Again, we're going to brace the skin, get it really tight and taut, whatever's more comfortable for you, and move away from the brace. That's right. Now, Ada's going side to side. You can go up and down too. The important thing is just bracing that skin and moving away from the brace. Now, as you get more adept with the system on the chest, especially if you're, Ada's young. I'm over 40. We do have more damage on our chest. Our skin's a little thicker. So as you get more comfortable with your machine, if you have that thicker, more damaged skin on the chest, you can actually move the suction up, or you can go to the coarse head, but I'd like you to use this several times before doing that.
Feels soft.
Yeah, it looks great too. That's beautiful. Okay, so that's it for the neck and the chest. Now we're going to move to the arms, the legs, the hands, and the feet. Okay, so we're going to move to the arms, the hands, the legs, and the feet. But before we do, we're going to switch the tips again. So this is when that coarse tip comes into play. Now the coarse tip, as I've told you before, I really only want you to use on your lower body parts. You're never going to use this tip on your face. But for the hands and the arms and the legs and the feet, it's perfect. So what I want you to do is start at the bottom and do longer upward strokes. Okay, so the skin on your arms and on your legs is a little tighter anyway. You won't get as much resistance, so it's pretty easy to do. So those are perfect strokes. The way Ada's doing this is perfect. So Ada, let's move to your elbow. Now this is an area where we're all rough and dry, and the great thing about this coarse tip is that it really will exfoliate, soften, and smooth the elbows. Now, do you have the bumps on the back of the arms? I do, but this is called keratosis pilaris, and it's a buildup of dead skin cells. They harden, and it's just really kind of irritating and can be uncomfortable. This constant exfoliation with the coarse tip will really smooth that out. Mine disappeared after about 30 to 40 days of continued use. That looks great. Okay, now let's move on down to the hands, Ada.
Okay.
Now, again, the hands. First sign of aging, hands always give away a woman's age, do they not?
I think my hands look older than me, yes.
Well, I think that too about myself. And the great thing about using this, and you, again, Ada, same thing, going to start from the base and just do nice short strokes. You can even do the tops of the fingers because our knuckles, that skin is really scaly. You can get rid of all of the dry skin on your hands. But it does two things with the hands. One, it's going to help to lighten any sun damage that you have on your hands. And two, going back to that collagen, our best friend, it's going to help stimulate collagen production and really plump out your hands. That's perfect. That's perfect. Okay, so let's move on to the legs.
Now, that's my problem area. Okay,
Oh,
I will
okay.
tell you now. I don't know about you guys, but I know my thighs, it's where I get all my hair bumps, and it's kind of, and the first time I used the machine, I was in heaven because I did not have to scrub every day.
Right.
And it lasted for a good week and that was the first time using it.
Right. Yeah, it
Without
is
any
true,
hair.
because we shave, most of us anyway, shave our legs, and so you do get ingrown hairs from that, the bumps, the irritation from, shaving rashes, and this is a great way to treat that. Another area, and this is a problem area especially for African American women, is the knees. They tend to be darker there, discolored knees. Well, a lot of that is just because you're not getting that dead skin off, it's not getting exfoliated, so it just gets darker and darker. So this is a great thing. Again, use that coarse head tip and really get after those knees. That's perfect. This is one area where you definitely want to turn up the suction control, okay? We can go a little stronger there, really get all that dead skin off. Now here's another little bonus, and this one's a winner. How much do you spend every month on pedicures? I don't know if you're like me, I go twice a month, that's at least $100. This coarse tip is the best thing on earth for corns and calluses, cracked heels. You can really use this to get all of that dead skin off and save a fortune on pedicures. Okay, that completes our treatment session. So in the next section, you're going to learn how to care for your new Brilliance system, and we'll inform you of some important post-treatment guidelines. Ada and I will be right back.
After every 1 or 2 treatments, throw away the filter. Gently wrap the tubing in the base, placing the wand back in the center of the unit. Your skin will immediately feel smoother, and you may even notice that the appearance of fine lines have already decreased in size. After each treatment, you may experience some redness and/or skin sensitivity. This is normal following a microdermabrasion treatment. It should fade shortly after a treatment. If you continue to have discomfort and redness of the skin, lower the vacuum suction setting and frequency of use until you are comfortable to continue using. You can give yourself a treatment 2 to 3 times a week depending on your skin sensitivity and reaction to the treatments. Keep your new Brilliance unit clean by wiping it with a dry cloth. Congratulations on your purchase of the professional salon-style home microdermabrasion system. You are now on your way to a new, beautiful you.
We really hope you're excited with your new system. And as you learn and develop your own style and routine, your treatment sessions will become shorter and shorter. A normal treatment should really only take you about 10 minutes to complete.
Now, I mentioned earlier that New Brilliance is so easy to use, and it is. It has become a part of my weekly routine. But it did take me several sessions to learn what settings were right for me and to learn how to use the different wands properly on different areas of my body.
And this is why it's important to watch this instructional video over again for your first few sessions until you become comfortable using New Brilliance. But once you do learn to use it properly, you are going to see amazing changes in your skin.
And be patient.
Yes.
You may actually begin to notice changes after the very first few treatments, but only after a few weeks will you really start to see an amazing change. I am so happy with the dramatic changes in my skin. It's softer and smoother, and it just feels fresh and clean all the time. I think you're really going to like what you see. The makers of New Brilliance promised you a personal home microdermabrasion system, and that's exactly what you have. I love mine.
And as a professional esthetician, I can tell you that New Brilliance is as close to a professional salon-style treatment as you're going to get at home. So enjoy your New Brilliance and your new you.